TopMedTalk.
Well, hello and welcome to TopMedTalk. We are coming to you from the AANA 2018 Annual Congress. The AANA is the American Association of Nurse Anesthetists, and we are in Boston, Massachusetts, the birthplace of anesthesia in the Ether Dome, which Monty has told us is less than 2 miles from this moment.
Very close.
I am joined this morning by TopMedTalk's own editor-in-chief, Monty Mythen, but he's actually working the desk for us today. Thank you, Monty.
It's an enormous pleasure.
That's right. We gave Nick the weekend off. So, Nick, if you're listening, we miss you, but I think we're going to fare okay. So, my co-host today is Josh Newman. He's a CRNA at Passavant Area Hospital in Jacksonville, Illinois. And he's not only the chief anesthetist in his group, but now he is the chair of the AANA ERAS Shared Interest Group, ERAS SIG. So thank you so much for joining us this morning, Josh. I really appreciate it.
Thanks for having me.
Yeah. Now, we are also joined today by a very special guest, Randy Moore. Randy, thank you so much for joining us.
It's a pleasure.
He is the Chief Operating Officer of the AANA, and he has given up 30 minutes of his morning, which I know you're super busy, so thank you.
No, I'm excited to be here.
I appreciate it.
Yeah, thank you for the invitation. Look forward to the conversation.
Yeah. So today I thought that we would start off by talking a little bit about this ERAS shared interest group that we are now piloting here at the AANA. Talk a little bit about what it is that we're doing and what we hope to accomplish by starting this group and how that's going to progress, what it looks like now and what we hope to see in the future. So, Josh, why don't you start it off for us? How did we start this conversation, I guess, on the Enhanced Recorvery SIG?
I think it started 2 or 3 years ago through the American Society of Enhanced Recovery. A lot of CRNAs came together and were discussing topics, but it wasn't very inclusive. We were very kind of segregated out on the outside discussing this. Enhanced Recovery has been picking up more and more steam, as you guys all know, and everyone listening I'm sure knows as well. We got to the point where there was a lot of AANA membership interest, a lot of CRNAs privately talking amongst each other with ideas and coming out with new pathways and ways to implement. And I think there was a real interest in how do we get a little more universal approach, how do we provide that expert knowledge to our membership, to all the CRNAs and anesthesia providers around, and really integrate what everybody else is doing and report as a universal whole rather than fractured implementations here, there, and all around. We got a green light go for this shared interest group from the AANA, from Randy, CEO, who I think also has his own separate interest in enhanced recovery. We're really fortunate that the leadership has that. Kind of brings us to where we are now, where we've got about 14 experts in the field of enhanced recovery and CRNA implementation, working through different pathways, working through different ways to present this knowledge and help out fellow CRNAs in really multidisciplinary areas. That brings us to kind of where we are today after our first in-person meeting.
Yeah, we did. We had our first meeting this morning where we were able to sit down with some of the AANA leadership as well as support staff that I think is going to be able to help us get up and going with that. So, Randy, whenever you heard about the idea of shared interest group in the AANA, we had never done anything like that before, right, in the AANA?
Correct. We've never formalized a shared interest group in the way that we're doing now. We certainly have specialty and subspecialty CRNAs who, whether it's in pain or acute pain or pediatrics, but this is our first real foray into solidifying a shared interest group which is resourced, managed by the staff, but really led by the volunteer leaders of the organization.
And how did you guys decide on the AANA as an organization that Enhanced Recovery would be that first pilot for the shared interest groups?
So Josh was being a little modest in terms of how this really...
Tell us.
Yeah. So Josh and I actually worked together back in Passavant Hospital in Jacksonville, Illinois, as recently as about a year ago before I moved into my role here. And one day, Josh and I were having a conversation in the office. I worked with Josh, and I said, it'd be interesting to explore what there is relative to enhanced recovery. This is, 3 years ago?
3 years.
And we were just really learning about it. And he said, yeah, let me look into it. And fast forward today, we're sitting here having a conversation about the amazing work that he's done at Passavant and implementing from nothing an enhanced recovery program that's really moved the needle on outcomes. And how do we scale that up across the profession? Because there's so many CRNAs who want to learn about enhanced recovery and who want to move the needle on patient care. This seems like the prime opportunity for us to pilot a shared interest group and see what resources we can provide CRNAs and other providers and develop relationships with our physician colleagues and other allied health to really move the needle on perioperative enhanced recovery.
Yeah, it seems like as I travel around and talk to other CRNAs groups, people around the country, a lot of these enhanced recovery initiatives are those grassroots movement, grassroots movement type initiatives, and a lot of it is coming from CRNAs. I mean, I think that as nurses as well, we've had this experience in the post-op care, in the nursing specialty, and then we're now in the OR and kind of had that background that we make a great leader in that space.
Yeah.
Is that one of the things that you think we can do with the Enhanced Recovery SIG, is to kind of create a leadership, almost platform, really, for those? I mean, Josh, what do you think? What are we doing in that space, you think?
Yeah, I think so. There's so much information out there on individual elements of the pathways. So the data's there. But in order to educate people how to become leaders, how to get this implemented throughout all the specialties and really get outside the anesthesia, the OR frame, is where it becomes challenging, and I think people have issues with. And I think that leadership areas is specifically where they want more guidance and kind of input back on how do you become a leader there, rather than just implementing your anesthetic changes. So yeah, I think that's one of the keys to this Enhanced Recovery SIG.
Yeah.
If I could add on to that, one of the things that we learned, and Josh learned pretty acutely, is that just how complex and challenging it is from a change management perspective to put in an enhanced recovery program, because it's just not anesthesia. It goes across the whole spectrum of care, and really getting the buy-in from the surgeons, the administrators, the nursing staff, even the anesthesia staff. Some of them aren't exactly interested in changing the way that they provide anesthetic. They've been doing it the same way for 20 years, why should I change? And I think that is where the leadership piece comes in, and the CRNA leader needs to really pull out and say, look, this is why we're doing this is where we're going, and this is who has to be on board, because it is a real undertaking. It's easy to sit here and say, let's do enhanced recovery. Putting one in is a challenge. Yeah,
absolutely. Anybody that's done any type of quality improvement project knows that, but I think enhanced recovery, because it does span the disciplines, the continuum of care, all those different areas, it's a huge monumental task. So with the ERAS SIG, what are some of the things that we are offering, like specifically, or talking about offering members that want to join the Enhanced Recovery SIG?
Yeah, as of right now, we're kind of telling member stories on how individual CRNAs have positively impacted a specific surgery subset or a specific portion of that perioperative process. So we're kind of putting those out on AANA Connect for people to read and digest, but then we're also providing increased resources in terms of journal articles or recent research, or even connecting peer-to-peer. Recently we had someone who was interested in doing thoracic enhanced recovery, so we've been able to connect different specialists to kind of get that ball moving for them. Mm-hmm. So we're networking and providing resources as needed. That's going to exponentially grow, as we kind of talked about this morning, and looking more into bringing in multi-specialty, but also patients in this kind of movement towards improved peri-op care. And that's where we're starting right now. It's going to be a big lift. It's going to take a little bit of time to get there, but we're starting small, providing slow resources right out of the gates to then move bigger and hopefully better as we go forward.
Yeah. From my experience just with the Enhanced Recovery SIG and just in our world of anesthesia, I feel like there's a real need for mentorship as well. Randy, how do you think that we can address maybe that with the ERAS SIG? Is that something that you guys had thought of with the shared interest group, the mentorship idea?
Yeah, I think that's a great observation. And one of the things that it's, as we move in this direction, is that we're learning into this. Mm-hmm. This is our first shared interest group. We're going to make some mistakes. We're going to learn from them, and we're going to move forward. And we're really developing the the framework for future shared interest groups within the organization. So you guys are kind of the canary, well, not the canary. You guys are the pioneers, and absolutely, I think going through the process and understanding where the pressure points are, and what are the resources that the AANA can provide relative to mentorship and support, and as CRNAs move into these shared interest groups, they're going to understand what it's like to move an initiative forward, right? Trial and error, obviously we're there to support them. But we're going to start creating educational content out of these shared interest groups that will now go to the broader membership and to other providers, and really start to develop some momentum in members. Instead of the AANA and headquarters creating content, we want the members to really take over a variety of different initiatives and move things forward. So yeah, mentorship's really important. And that's one of the things that we do relatively well at the AANA. We can always get better, but identifying where the talent is, developing them from a leadership perspective, and this is just one of the avenues to do that.
Yeah. Where do you see the future of the Enhanced Recovery SIG, next year and in 5 years? I know, Randy, Josh was saying that you're a big kind of future guy. You love to see the big picture and the vision and have a vision for it. So where do you see the Enhanced Recovery SIG going in that direction?
Well, I think when we reach that ideal future state, whatever that is, this is a collection of thought leaders who are really going to create high-quality educational content and start connecting and networking with other providers who share the same interests. Mm-hmm. And from our perspective, it's leveraging the talent of the membership in ways that we probably haven't done in the past. Mm-hmm. Because there's a lot of people who have the expertise like Josh, right? Who's out there, who's doing it, who he learned through trial and error in putting in a program. Well, maybe we can decrease the learning curve on a variety of different things. And another thing that is really important is, a lot of our shared interest groups as we move forward are going to be clinically based. But there's other things within the profession that are important, whether it's diversity and inclusion or people who have interest in business or leadership. I think that this is a platform to support that and grow that and then scale it across the organization.
Yeah, that's great. Josh, do you have any other thoughts on that?
You keep hearing the mentorship kind of bleed through all of these discussions, whether it be the AANA mentoring us in terms of leadership or us mentoring other CRNAs interested in enhanced recovery. I think that is, you brought it up, I think that is key. I think that kind of not having to do the learning curve all over again is important. Yeah, I agree with everything here on the mentorship.
Yeah. One of the things that I think is really important in our microcosm of nurse and anesthesia, CRNAs, but also as we expand out, is how we're going to do the outreach to other professional organizations and other providers in this space, because I think that we have the opportunity, just because that's kind of who we are in our core as nurse anesthetists, being in the OR, we kind of always the common denominator of everybody, and so how do you think that that's going to work? Like, where should we begin whenever we start reaching out to some of our physician colleagues and nursing colleagues, allied health professionals?
Well, first and foremost, it's important to acknowledge the amazing work our physician colleagues have done in this space. And we're definitely building upon that. But we're also if you think about the way that enhanced recovery is proliferating through this country right now, CRNAs are a huge part of that. Mm-hmm. And we should be proud of that. Mm-hmm. And in collaboration with not just our anesthesiologist colleagues, but our surgeon colleagues, too, who absolutely play a key role. I'm here to tell you, if the surgeon doesn't buy into enhanced recovery, it ain't happening.
Exactly.
So I think to some extent, the organization and maybe even a subset of the providers, CRNA providers, have been too internally focused. But you can see where healthcare is going in this country. Mm-hmm. Whether the way it's being designed and reimbursed, CRNAs have to have a seat at the table. They have to understand what their value is. They have to understand the pressure points that are occurring in healthcare. And enhanced recovery is a good exemplar of how, if you implement quality programs, what the impact on healthcare delivery is going to be, especially on the expense side, right? I mean, reimbursement is shifting as we speak in this country, and CRNAs are going to be a big part of that, because surgical care is a huge piece of what's of the price tag for healthcare in this country. So sometimes we lose perspective, or we can't see the forest from the trees in terms of where CRNAs are and what they're doing. And I think this is the time that we really need to stop being so focused internally and start networking with our colleagues, and not just the physician side, but the nursing side too. Yeah. And we really are at the AANA making a pretty aggressive effort to collaborate. We're working with, in ways that we haven't in a very long time, the American Society of Anesthesiologists. It's been a challenging relationship, but I think both sides of the equation now appreciate we're much stronger when we work together on these issues, especially clinical outcomes. Yeah. And so that work, some of that is thawing, and that work is starting to begin in earnest. So we're very excited about that.
That's fantastic. I think this could be really something that we work together on, the enhanced recovery movement. Now, one more question, kind of comment. One of the things that in my professional and almost personal experience with enhanced recovery in my own practice and in our group is that it's really kind of shifting from enhanced recovery per se and to just enhanced or optimized perioperative care.
Right.
And so I kind of feel like, and please, Josh, maybe you can comment on this, feel like, we should maybe have a little bit forward thinking into, do we start calling it perioperative care? And, where do you see that going?
I think you're right. I think deeming it enhanced recovery kind of isolates people, that it falls into the specific track. But as you kind of dial back and look at the broader picture, we're really trying to optimize patients pre and post and maintain that intraoperatively. I agree. I think moving to perioperative care spells out what we're really trying to accomplish more so than just enhanced recovery. And I think more people buy in with the idea of peri-op care, improved peri-op functioning and functionality.
Yeah. Actually on the SIG, one of our first stories that we put on AA Connect, the first story that we put on AA Connect, is from Carol Schmidt. She is a CRNA leader at her facility in Michigan. And some of the things that she tells us there and stories that she's told us is that a lot of people may not be doing enhanced recovery per se, but they are doing these quality improvement projects that are in that space of perioperative care. And I think that is a really great opportunity for us to be able to get in that space and not necessarily focus on intra-op so much, but extend how we our presence, I guess, in that perioperative care space. Randy, can you speak to what the AANA is looking forward to when it comes to perioperative care in general? And, I mean, do you kind of feel the same way about enhanced recovery and perioperative?
Oh, yeah. And if you look at the way healthcare is being redesigned and the movement towards alternative payment models, and there's going to be a rapid acceleration towards affordable care organizations and alternative payment models, and more of our reimbursement is going to be at risk based on the quality, right? And I think that's okay. I think because it incentivizes us to focus on what's important in ways maybe that we haven't. And it also forces us to sit at the table with other providers and say, okay, we're all in this thing together. So if this patient has a poor outcome, first, the patient's going to suffer, and that's a terrible thing. Right. But two, we're going to suffer professionally too in terms of our reimbursement. And oh, by the way, our outcomes are going to be very transparent now.
Yeah.
All you have to do is Google it, right? Yeah. So the days of us being a siloed set of providers or organizations, I think, are numbered. And that's why we really have to understand what our value is in the marketplace as in physicians and CRNAs. And how can we navigate together in negotiating whether we're in an alternative payment model or we're moving into an ACO or whether we're in the MIPS program. How do we work together to optimize patient care and ensure that we still have a seat at the table? Because things are transforming as we speak, and we can't afford not to be engaged.
Yeah. Absolutely. All that's going to come to by knowing outcomes, knowing what your outcome is, and figuring out what we're all doing every day and how that impacts the patient along their journey, not just intraoperatively. And I think that that's a huge piece of that value care model as well. Well, we are here at the conference, the AANA conference in Boston, and I think we should wrap things up. Randy, thank you so much for joining us and sitting down with us. Hopefully we have another opportunity to do it and talk about some other things that are maybe specific to the AANA that we can share with our members, but also some other initiatives that the AANA is working on to help, again, that multidisciplinary team come together and improve outcomes for our patients. So,
and maybe we can get our ASA colleagues together.
I think it'd be fantastic.
And have a conversation together. I think that would be a lot of fun.
It'd be a lot of fun. Yeah. It'd be fantastic. Yeah, thank you so much. And Josh, thank you for sticking around. You're headed out on family vacation today, so not going to be able to. Maybe I wasn't supposed to say that. Sorry. No, thank you so much. Make sure to listen to TopMedTalk on your favorite podcatcher, Apple or Android, and please follow us on social media. We are on Facebook, Twitter, LinkedIn, YouTube, and also please subscribe to TopMedTalk. So every day you have a new podcast delivered to your podcatcher, and you have weekly updates and updates for meetings, upcoming meetings, and live streaming events as well. So thank you so much for joining us. We look forward to other conversations here at the AANA. Cheers.
TopMedTalk.